Welcome to NCLEX Map, where we simplify nursing science into clear, confident action. Today, we're diving into a crucial topic: fluid and electrolyte balance. This knowledge separates safe nurses from the rest. Let's explore what happens when fluids shift and electrolytes drift. We'll learn how to spot and fix problems before they harm your patient. Fluid balance is essential for homeostasis. It's literally the lifeblood of our bodies. It affects how well we can perfuse every organ with water. Electrolytes are the charged minerals in that fluid, controlling everything from muscle function to brain activity. Remember this core rule: sodium controls the brain and water movement. Potassium drives the heart and muscle contraction. Calcium stabilizes muscle tone and nerve transmission. Magnesium calms the neuromuscular system and smooths the rhythm. When these electrolytes shift, you'll see changes in mental status, heart rhythm, and blood pressure. That's why NCLEX and real hospitals test this constantly. Fluids exist in three compartments: intravascular, interstitial, and intracellular spaces. You interpret these through mental status, vital signs, and urine output. Let's talk about the core labs you must know. Sodium, or Na+, has a normal range of 135 to 145. It governs water balance and brain function. Low sodium, or hyponatremia, can lead to confusion and seizures. Nursing priorities include performing neurochecks and anticipating hypertonic saline if severe. High sodium, or hypernatremia, means dehydration or excess sodium, leading to agitation or seizures. Replace water carefully and monitor neurostatus closely. Potassium, or K+, has a normal range of 3.5 to 5. It's crucial for cardiac rhythm and muscle contraction. Low potassium, or hypokalemia, can cause muscle weakness and arrhythmias. Replace potassium carefully, never IV push, and always monitor heart rhythm. High potassium, or hyperkalemia, is a cardiac arrest risk. Act fast with telemetry and insulin. Calcium, or Ca2+, has a normal range of 8.5 to 10.5. It controls muscle tone and nerve transmission. Low calcium can lead to twitching and airway issues. Airway comes first. High calcium means lethargy and constipation. Get them moving and monitor rhythm. Magnesium, or Mg2+, has a normal range of 1.5 to 2.5. It stabilizes rhythm and relaxes muscles. Low magnesium can cause tremors and arrhythmias. Administer magnesium sulfate and monitor closely. High magnesium can lead to respiratory depression. Stop magnesium sources and support the airway. Now, let's discuss fluid volume. Dehydration versus overload. Dehydration means the vascular tank is empty, leading to tachycardia and hypotension. Interventions include isotonic fluids and monitoring vital signs closely. Fluid overload means the vascular tank is flooded, causing hypertension and crackles. Elevate the head of the bed and anticipate diuretics if needed. Next, let's cover IV therapy skills. Start with the order. Verify fluid type and rate before setting up a peripheral IV. Always use sterile technique and prime the tubing to avoid air bubbles. Know the difference between infiltration and phlebitis. Both require immediate action. Infiltration means fluid leaks into tissue. Stop the infusion and elevate the limb. Phlebitis means inflammation of the vein. Stop the infusion and apply a warm compress. Now, let's look at some clinical scenarios in practice. A post-op patient is NPO and vomiting. Assess for hypovolemia and notify the provider. A renal failure patient on IV fluids shows signs of fluid overload and hyperkalemia. Act fast. If a patient reports burning at the IV site, it could be chemical phlebitis. Stop the infusion immediately. Finally, let's simplify teaching for learners. Connect each electrolyte to its target organ. Sodium for the brain, potassium for the heart. For fluids, teach the concept of a dry tank versus a flooded tank. And for IVs, always ask, would you leave that line running into your own arm? If not, stop it. Safety first. That's your guide to fluid and electrolyte balance, from the molecular level to the bedside. Remember, fluids and electrolytes are the pulse of patient safety. If you found this helpful, like, share, and subscribe to this informative channel, your go-to resource. Stay sharp, stay steady, and keep mapping your way toward excellence. I'm your guide from NSLEX Map, and I'll see you in the next journey toward mastery.